When you finish treatment, you might find that a whole bunch of other thoughts, important thoughts, big stuff that you haven't kind of made space to think about before, might start popping up, might start rearing its head. And it's okay to not have to feel totally positive when you finish treatment. I think that's often a time with a lot of the patients that I've worked with that, that struggle to be positive is the most difficult, because often, we can expect ourselves, having finished treatment, to just bounce back and get back to life as usual. Our family and friends around us, and certainly our communities, can expect that, oh well, you're in remission, everything's okay, you get back to life, it's all better now. And often that's the trickiest time, because in my experience, that's the time when a lot of young people actually sort of process what they've just been through and go, oh my gosh, what just happened, and what does that mean, and what's going to happen in the future now, and what does my future look like now? And so that time after you finish treatment, when you're a so-called survivor, can actually be a really tough time to be this kind of positive, inspiring survivor when you're going through all this stuff inside. So I think, if positivity and kind of adopting a positive attitude is helpful for you, then embrace it when it is helpful. I think it's also helpful to know that sometimes it's not going to be what's easy, and it's not going to be what comes naturally, and that's okay too. So I think the most important thing is to be flexible. So don't expect yourself to be able to cope the same way all of the time, and across your whole journey, how you cope and what's helpful for you is going to be different at all of the different points. And I think, when there's people around you that you feel like are maybe pressuring you to kind of stay positive or look on the bright side or not have negative thoughts, I think it's okay to gently let them know that, hey, I know that you're coming from a really good place. I know that you mean well, and I know that you just want the best for me. But this has been a pretty full-on experience for me too, and there's a bunch of stuff that I've just, got to think about and I've got to work through, and it's okay for me to have those thoughts as well. And if you're struggling with this stuff as well, there's probably people in your team, maybe a psychologist or a social worker, that you can maybe use to talk to about some of this stuff to kind of help you figure out how's the best way for you to cope, or what to do with all of these different thoughts as well.